Welcome back to Talk 1260 KTRC. This is the Humanity Behind the Vanity. I'm Dr. Daniel Ronel here with my wife Betsy.
I'm still here.
We just heard from Marion Urban, and we're going to keep talking about liposuction.
Right. Yes. Okay. So we just finished off, for those of you tuning in, going over 3 types of lipo. Power-assisted lipo, which is best for the entire body. Water jet lipo, which is best for large volume lipo, but as the doctor says, it's not ready for prime time. And then laser-assisted lipo, which most of us have heard of, smart lipo or cool lipo, and that is better for spot treatments. And Dr. Ronel thinks it's awesome. He does not have a machine yet because he is waiting for a better one to come out.
Right.
And then we said we were concerned because a lot of different types of practitioners jump on the bandwagon trying to offer the newest and the latest. And then we also said, but that's just the way of business because somebody has to try it out, and this is how the companies learn as well. They probably give some machines to certain practitioners to, say, look, and then give your patients a discount and, tell them this isn't for sure yet, but we're working on it. So I don't know. I'm not in the marketing departments of lasers, but that's my assumption. So anyway, jumping on the bandwagon is fine. It's just buyer beware, because although the practitioner has the best intentions of the patient is the one in their hands and may accidentally, of course, suffer from it. So you've got to be careful to whom you trust your body and your safety of health with.
Right.
That's all.
Right, and when you see in the magazine an ad for the latest and greatest liposuction machine or facial treatment, that is not coming from the medical community. That's coming from a capitalistic company that's making it.
Right,
so,
the laser company.
Right, so caveat emptor.
There we go. Okay, on to the next one. Ultrasound-assisted lipo. Vaser. Best for the back, love handles, tummy, and hips.
This was one of the first energy source machines to get out there, and it's been around for a long time. We know how to use it safely and unsafely. It can cause burns, but we've learned how to avoid that. So it is a little older than the sort of the newer laser ones. Vaser is fantastic for, and Vaser meaning ultrasound-assisted liposuction, is great for the fat in men, which tends to be more fibrous, especially around the breast and around the love handles. And some people have a hump in the back and between their shoulder blades. That fat there is really hard to get out, and so you need to melt it somehow. And that's where the ultrasound-assisted liposuction works. I like that one.
Can I make an interjection?
Yes.
Aren't there people suffering from AIDS, HIV, and that's one of the results of the treatment or of the disease, the illness?
It's really a result of the anti-retroviral medicines that they take.
Okay.
It causes a condition called lipodystrophy.
Right.
Also, people who have Cushing's disease, which is an endocrinological disease, which one of our dogs has.
We've had 2 dogs with that now.
Yeah, and they also get what's called a buffalo hump, which is a deposit of fat in between the shoulder blades.
Yeah, I've seen that on women and men. So if you have that, here's a great way to take care of it, the Vaser.
Absolutely.
Vaser lipo.
Okay.
Okay. All right, so the next and last is radio frequency lipo, best for faux figures.
This is really a hot thing that is being studied. I don't think it's ready for prime time, but I'm very interested in it because it, I think, has the capability, the true capability to tighten skin.
Really?
Yeah.
Wow.
The laser
Okay.
I'm sorry, the laser lipos do that to a certain extent, and they certainly claim it, but I don't think people quite understand that yet. But this radio frequency certainly has the capability of doing it. We just have to see whether it's safe or not.
What people don't understand, the professionals making it or the patients?
The professionals making it. It is just now coming onto the market, so it's still undergoing clinical trials.
Wow, so I would like that. I mean, after a certain age, everybody, no matter how skinny you are, your skin loosens, has laxity. So what does that mean? I mean, that's...
I don't know what it means. It sounds pretty good, but we'll have to wait to see what happens.
So say...
I just wanted to talk about the tried and true traditional tumescent liposuction, just to explain. All of these are being compared to tumescent liposuction. Tumescence just means turgid, filled with fluid.
What's turgid?
turgid means full and swollen. And what it is, when you do liposuction, you have to insert into the skin and the fat a solution with an anesthetic in it and with something that vasoconstricts, that constricts the blood vessels. So there's very little blood loss with liposuction.
True.
And that's called tumescent liposuction. And before you actually go in with whatever cannula it is, whether it be the regular old workhorse cannula or the power-assisted liposuction or the Vaser that we've talked about.
Smart.
Yeah, the laser
Smart
lipo.
Okay.
Before you do that, you have to prepare the fat. You have to inject it with an anesthetic, right? You have to inject it with an anesthetic, and you have to put a vasoconstrictor in it so it doesn't bleed a lot. And that's called tumescent liposuction, and that is what underlies all of these techniques.
And, okay, so no matter what, you'd still do that, right?
Yes.
So interesting. Okay, so say something, because I've seen on these plastic surgery shows, you know, a skinny little girl going in, not little girl, people, I mean over age, you know,
Right.
the right legal age, 25 say, pre-children, pre-marriage, pre-everything that makes you fat. And she goes in, can I have a little section right here above my hip? Can you take care of that, doctor? It's fat. I wish that was my problem. Do you then, that doesn't happen to you, but on these shows, they don't show this. Do they then pump her up with tumescence first?
Mm-hmm.
They don't show it because it makes that section larger.
Yeah, and I have to say that in a thin person with a tiny little spot area, any of these techniques is going to look fantastic. So
what happens if the doctor takes too much?
then you get an irregularity. You get a contour irregularity in the skin. It's very hard to treat. Lumpy, bumpy. It can sometimes cause pain. In worst case scenario, the skin adheres to the underlying tissues and leaves a big scar there. But usually what happens is you get a contour irregularity. And the way to treat that is to either do liposuction around it to try to even it out, which is very difficult to do.
Sure.
I've had, just about a month ago, I did a patient who had a contour irregularity of her abdomen, and I had to do a tummy tuck. I had to open it up and go in there and actually sculpt the fat under direct vision, and that is a little dramatic,
Right.
but that's what you have to do.
Situation.
The real technique for liposuction is something called cross-tunneling, which you have to do. The cannula, whatever it is, laser or not, has to be inserted at right angles to each other. Those of you watching on YouTube are watching me put my finger in different directions.
Right.
That cross-tunneling has to occur before the suction is applied to the cannula. Because what that does is it creates it breaks it up and it makes a little scaffolding into which the cannula can go. And surface irregularities occur when this is not done. And people who don't have a lot of experience don't understand how to do it.
Do they learn that in those weekend courses?
I don't know.
Yeah, interesting.
Okay.
Okay.
All right, we actually have to wrap this up.
Once again.
Thanks for listening to our big talk about liposuction.
So thanks for listening. We are becoming more and more aware that we have a growing audience, and we really appreciate it. We hope that you enjoy the show, and we look forward to all of your comments.
And thanks to our generous sponsors, Suniva Medical, the makers of Artifil, and iFlow, the makers of the pain pump. And give us a call anytime, 982-2440. And I have a brand new website, danielronelmd.com, made by Studio X.
It's really very pretty, new logo and everything. That is a local Santa Fe company.